people use alcohol and drugs for a variety of reasons. Some people are able to control and enjoy their drug use without causing any significant harm to themselves or anyone else, but other people find this a lot more difficult. So often the people who experience the most difficulties in controlling their use of substances are people who have faced particular challenges in their early lives. So, for example, they're much more likely to have experienced verbal abuse, physical abuse, sexual abuse, or things like household dysfunction. So, where they've grown up around domestic violence in the house, mental illnesses, drug use or alcohol use by the parent. And together, these risk factors are sometimes referred to as adverse childhood experiences, and they're also known as ACEs.
So if a young person's using substances problematically, this can affect their physical health. So it disrupts their sleep patterns and causes like weight loss, for example. And it also affects their mental health. This can in turn affect their performance, like at school, and also their relationships with family and friends.
So substances are often used to bring in young people and entice young people to do things that they wouldn't otherwise do. That can be getting hold of drugs, and that can be because they're already under the influence of drugs. And this can lead to further exploitation, one of which is drawing young people into the supply of drugs, and that's often called county lines. So those kind of experiences where young people are exploited often drives them to use substances in more problematic ways. The reason they're doing that can be to escape or to manage the trauma of the situation they find themselves in, and that in turn potentially makes their situation worse, and they engage in the vicious cycle of exploitation and substance misuse.